Would you know what to do if your child stopped breathing? Well, today I'm going to teach you how to do CPR on an infant. An infant is 1 year or less. A child is anything above that, and then there's the adult that goes beyond. First, I'm going to discuss the importance of CPR. Second, I'll discuss the step-by-step process on how to perform CPR. And then third, I will share ways in becoming CPR certified, which is also on the handouts that I handed you guys earlier. Today I picked this topic because I actually work at Doctors Medical Center in the emergency room and in radiology. I've actually had the opportunity to perform CPR on an individual before, but I have never performed CPR on an infant. CPR stands for cardiorespiratory resuscitation. The importance of CPR was developed to increase one's chances of survival in an emergency situation by compressing one's chest and breathing into their mouth to open up the airway to allow airflow into the lungs. According to the American Heart Association, CPR can be performed in two different ways, either the full way, which is compressions and rescue breaths, or just hands-on. Hands-on is usually when it's somebody who's not CPR certified or doesn't have experience and they just know about the compressions. You can just do hands-on. CPR is actually leaning towards just hands-on just because of the amount of viruses, diseases, everything like that, and compressions work really well. CPR on an infant is actually a ratio of 30 and 2. So you're going to do 30 compressions and 2 rescue breaths. That's if it's just you as a rescuer, but if there's 2 individuals, then you do a ratio of 15 and 2, which is 15 compressions and then 2 rescue breaths. So next I'm going to explain the steps in CPR. Step 1 is you're going to examine the baby. I brought a baby doll today that I had when I was a kid. And so you're going to examine the baby, you're going to stroke the baby, tap the feet, baby, baby, wake up, but don't ever shake the baby. Step 2, you're going to check the brachial artery and check for a pulse. The brachial artery is right here, right below their arm. If there's no pulse and the baby's unresponsive, you will then proceed to step 3, which you're going to place 2 fingers right in the middle of the baby's chest, just below the nipple line. And then you're going to start compressions for at least 2 minutes, which is the ratio of 30 and 2 because I'm the only rescuer. Step 4, once you start compressions, you're going to do this for 2 minutes until you dial 911 or call for help. So you're going to count out loud 1, 2, 3, 4, 5, all the way to 30. Then you're going to proceed to step 6, which you're going to give the baby rescue breaths. You're going to put 2 fingers below the baby's chin, then up on the forehead, and you're going to tilt the head back so that it opens up the airway, and you're going to cover the baby's nose and mouth with your mouth and give 2 rescue breaths. Step 7 is you're going to continue all of this for 2 minutes. If there is somebody else with you, you would switch off because after 2 minutes, even less than 2 minutes, you get extremely exhausted and start sweating. Step 7 is once you continue this, then you are just going to continue until you see signs of life or until medical personnel has arrived. So there are several ways. So the third step, the third process, I'm actually going to explain that there's different ways to become CPR certified. I handed out these papers. And you can actually just Google CPR certifications and you can get CPR certified anywhere around here. I actually got CPR certified here at MJC for the first time when I was younger, and they have classes, and it's only 1 day. It's like 4 hours, but I thought it was extremely fun. But then once I started working in the hospital, then I had to get BLS certified, which is exactly the same thing as CPR. It's just for the healthcare profession. Your CPR certification lasts for 2 years, and then you have to re-get certified. I just recently had to get certified because I've been working at Doctors for almost 4 years now. And then according to my mom, who is also a registered nurse in the emergency room at Memorial, she says that it's extremely important for people to get CPR certified, and she can't emphasize enough how many patients she's had come into the ER that have lived because somebody else performed CPR on them. So overall, I went over the importance of CPR, the steps, and then also the different places and where you can get CPR certified. And I hope that you can all learn from this, and hopefully you don't ever have to perform CPR, but now that you know how to perform CPR on an infant, if you're ever put in that situation. Thank you.